Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today, I have brought to you a series of lectures which are about inguinal region, anatomy of inguinal region. So here I'll be teaching you anatomy of inguinal canal, how to draw the inguinal canal. I will also take you through the anatomy of direct and indirect inguinal hernia. Today we are discussing anatomy of inguinal canal. The links for the other 3 lectures are given in the description section. I strongly advise you to watch all these lectures together. This lecture, I think, is not only for an MBBS student who is studying anatomy, but also for an MBBS student in the final year when they are trying to study surgery. It's also for students who are already doing post-graduation in surgery to brush up anatomy of inguinal region. I hope this really helps you students. This is a topic that is so oft discussed. Okay, so this is my contribution to your studies. Let's dive in. Okay, anatomy of inguinal canal. Students, this is part 1 of the lecture on inguinal canal. As usual, a request, please sit with color pencils, drawing implements, so that when I ask you to draw, please do draw. Believe me, drawing helps you to understand and recall way better. So question, all you medical students always have this question, ma'am, why do we have to need to study all this? You have to study it because so many times in the exams they will ask you what is superficial inguinal ring, what is deep inguinal ring. Or they may ask you to write a note on inguinal canal. Or they may ask you a case in inguinal hernia. They may ask you lots of MCQs. They do. Lots of MCQs are asked on the inguinal region. Or in your own OPD, you will routinely see cases of hernia. It's a bread and butter surgery for surgeons. So it is a topic that is very relevant. So that's why you have to study it. Let's begin by creating a visual impression. Where is inguinal canal? Take a look. Now here you can see that somewhere in the lower abdominal region there are 2 tubular structures created indicating the site where there is the inguinal canal. This is very diagrammatic. It's different, but this is how it looks. Right. So before we understand inguinal canal, you should know your inguinal ligament well. Now you must be thinking, ma'am, we already know inguinal ligament. Yes, but do you know all the extensions of inguinal ligament? Take a look. Let's just brush up the anatomy. So here you're seeing the articulated pelvis. What are the attachments of inguinal ligament? You will tell me it goes from anterior superior iliac spine to pubic tubercle. Perfect. Now tell me what are its extensions? One is the lacunar ligament, which is a small triangular projection from inguinal ligament posteriorly. Take a look. From it, a thread-like extension backwards along pecten pubis is called the Cooper's ligament. And from the inguinal ligament, sets of fibers travel medially towards the linea alba. Okay, this is called as the reflected part of inguinal ligament. So now think. Inguinal ligament from anterior superior iliac spine to pubic tubercle gives rise to 3 extensions. One is the lacunar ligament, triangular. 2 is the pectineal ligament and 3rd is the reflected part of inguinal ligament. Please come back to this slide or this part of the video whenever you are forgetting these terms. Okay. With this basic information, let's begin inguinal canal. Okay. I've always said that it's important to bring your mind into that anatomy. So, what is inguinal canal? Where is inguinal canal? So, as the name suggests, inguinal canal is a canal. Between what? It's a canal formed between muscles. Okay, so muscles, muscle aponeurosis and fascia. In between them, a kind of space gets created. That space is inguinal canal. Where is it? Like I showed you, lower abdomen. Why is it? What is it? Where is it? Why is it? Why is it developed? If abdominal wall is there, then why do you want to keep a canal in it? Take a look. to communicate structures between the abdomen and the perineal region. You have a perineal region in the males and females. Okay, a communication between the abdominal cavity and the perineal region happens through the inguinal canal. So quickly ask yourself, do you know what is inguinal canal? It's a canal between muscles, aponeurosis and the fascia. Where is it? The lower abdominal region. Why is it? To communicate abdominal contents with the perineal region. Got it? Now let's go to the next slide. This is a very important diagram. I'll ask you to draw it later, but just to understand that some features of inguinal canal. Okay, inguinal canal is about 4 centimeters in length, extends from the deep inguinal ring to the superficial inguinal ring. Yes, all of us know this, but where is the deep inguinal ring? Take a look. Here, posteriorly is the deep inguinal ring. You can see that there are muscles covering it. Okay, and here is the superficial inguinal ring. I'll be teaching you each of these, don't worry. Okay, so extending from the deep inguinal ring to the superficial inguinal ring is your inguinal canal, with the direction of the canal is downwards, forwards and medially. So 4 centimeters in length, extending from deep ring to superficial ring. Direction of canal downwards, forwards, medially. Got it? Okay. So let's move forwards now. Now I have created this image, which is and it helps you to really understand. Okay. You know that it's a space between muscles such that the inguinal canal will have an anterior wall, a posterior wall. It will have a roof, a floor. It will have an upper end represented by deep inguinal ring, a lower end represented by superficial inguinal ring. So these are the 6 things that you need to know to understand inguinal canal. Very simple. Okay, so let's begin. What do you want to know? You want to know which is the anterior wall, which is the posterior wall. You want to know what is forming the roof, what is forming the floor. You want to know what is deep inguinal ring, upper end, what is superficial inguinal ring, lower end. Simple? Let's begin. But if you want to understand all this, you have to revise abdominal wall. I can't teach you the entire abdominal wall. There is no time. But it has been taught to you. I will help you to revise it. Okay. First, we have to know what are the muscles that are there forming the abdominal wall. Right. So now just put yourself in a place where you are seeing the cadaver or the living human being. Okay. There is skin covering the lower abdominal region. Right. What is there below the skin? Superficial fascia. So the first structures you see in this region are skin and superficial fascia. Remove it. What will you see? When you remove it, now take a look at all these images. They are very relevant. What you see now is the external oblique muscle and a gap in its aponeurosis. Can you see this triangular gap, students? This triangular gap is your superficial inguinal ring. Superficial inguinal ring is a gap in the aponeurosis of this external oblique muscle. Okay. Now let's go a little deeper. What do you find deep to external oblique? Can you see these fibers here going medially towards the linea alba? Yes. So these are I taught you that. These are the reflected fibers of inguinal ligament, immediately behind the superficial inguinal ring. Deep to this, what do you find? Deep to this, you find the internal oblique muscle. Can you see the internal oblique here? Fibers curving and then coming medially in this manner. This whole muscle is your internal oblique. Now what will you find deep to that? Transversus abdominis. Again, similar fibers going from inguinal ligament, curving medially, and together they unite to form what is called as conjoint tendon. Ask yourself, आता है क्या? Internal oblique curving, transversus abdominis curving. Together they are uniting medially to form the conjoint tendon. Deep to this, you find a simple sheet which is called fascia transversalis. All this blue that you're seeing is fascia transversalis, But you will say, ma'am, there is a hole in it. Yes, there is a gap in it which is called as the deep inguinal ring. Extending from this deep inguinal ring to this superficial inguinal ring is your inguinal canal. Got it? Let's revise. Okay. So, most posteriorly, what do I get? Fascia transversalis. What is the gap in it called? Deep inguinal ring. What will I find immediately in front of it? Transversus abdominis. What will I find in front of transversus abdominis? Internal oblique. The two internal and transversus unite medially to form which tendon? Conjoint tendon. Can you see how conjoint tendon is situated posterior to the superficial inguinal ring? In front of conjoint tendon are the reflected fibers of inguinal ligament. Now what is the next layer? External oblique. The gap in it is called as superficial inguinal ring. Finally, all this is covered by skin and superficial fascia. Got it? So let's revise one last time. Believe me, it's important that we revise this. From anterior to posterior, there is skin, superficial fascia. There is external oblique with a gap in it called superficial inguinal ring. Behind that, you have internal oblique. Behind that, you have transversus abdominis. Behind that, the two muscles together form conjoint tendon. Behind this, you have fascia transversalis with a gap in it called the deep inguinal ring. Okay. So, these are the layers. I want you to just look at this, learn it up in your brain, because later on, this is what we're going to discuss. Okay. With this abdominal wall in place in your brain, let me begin discussion of all the various boundaries of inguinal canal. Take a look at this diagram here. This is a transverse section diagrammatic through the inguinal canal. Now, this is very important that you understand where is the canal. This is the canal here. This one. This is the deep inguinal ring. This is the superficial inguinal ring. And extending from deep to superficial is this dotted canal. Got it? Okay. Now, question is, what are the structures which are forming the anterior wall of my inguinal canal? So, you can see the structures. The anterior most is skin. Next is superficial fascia. Next is external oblique aponeurosis with a gap in it called superficial inguinal ring. And deep to that is a little bit of internal oblique muscle. Look at the image, understand. 1 skin, 2 superficial fascia, 3 external oblique with a gap in it called superficial inguinal ring, and 4 internal oblique. Take a look, 1, 2, 3 and a little bit of internal oblique are forming the anterior wall. Okay, so your anterior wall is formed. But there is a gap in it called superficial inguinal ring, which is something we need to discuss. So what is superficial inguinal ring? I have been repeatedly telling you, what is it? It's a gap in the aponeurosis of which muscle? External oblique. What is the shape like? You can see an answer. It is triangular. Okay, it's called as a ring, but it is triangular. Now you can see that it has got a medial edge and a lateral edge. The medial edge is called as medial crus. Lateral edge is called as lateral crus. The point where the two edges meet is called as the apex, and the base is where they get attached on the pubic bone. So you have to imagine it like this: medial crus, lateral crus, pubic bone. So this part which is attached to pubic bone is the base, and this part where the two meet is the apex. Superiorly, you also find these horizontal fibers, which are intercrural fibers holding the two crus together. You just imagine if the crus begin to separate out, the gap becomes too big and it allows for herniation. So you have to have intercrural fibers holding the two crus or crura together. Measures about 2.5 by 1.25 centimeters. Now question is protection. Why do you need protection? What is this protection? Question is, abdominal wall is a complete wall. There is a gap in it. Structures are going to want to come out through the gap. How do you prevent it? by providing protection to that gap. What is the gap called? Superficial inguinal ring. How will you give protection? Let's take a look. Okay. So situated behind the superficial inguinal ring are the reflected fibers of inguinal ligament, and behind that is the conjoint tendon. These two structures provide protection to the superficial inguinal ring, preventing structures from passing through the ring. Take a look. So here's your external oblique and superficial inguinal ring. Here's the ring. You can see how posteriorly it is strengthened by presence of reflected fibers of inguinal ligament, further posteriorly strengthened by internal oblique and transversus abdominis, together forming the conjoint tendon. So who protects superficial inguinal ring? Reflected fibers of inguinal ligament and the conjoint tendon. Okay. Continuing with this, what is external spermatic fascia? Remember, external oblique muscle, aponeurosis, continues from the superficial inguinal ring into the scrotal sac as external spermatic fascia. Just remember it. It's a continuation of external oblique muscle. What exits out of a ring? If there is a ring, something must be coming out of it. What comes out of it is ilioinguinal nerve, and in males, spermatic cord, or in females, the round ligament of uterus. We'll revise this again later. So what have we done? We are done with the anterior wall and we are done with the lower end superficial inguinal ring. Let's now talk about the posterior wall and upper end deep inguinal ring. Okay, so same diagram. Here you are seeing again, this is the deep inguinal ring, this is the superficial inguinal ring, and in between them is the inguinal canal. The posterior wall are all these structures. All these structures are posterior wall. What are they? Posterior wall is formed by reflected fibers of inguinal ligament, conjoint tendon. What is conjoint tendon? Fibers of internal oblique and transversus abdominis coming together medially, inserted on the pubic bone, supporting the superficial inguinal ring posteriorly. This is the conjoint tendon, and the complete posterior wall is formed by transversalis fascia here. So what is this? Reflected fibers of inguinal ligament, conjoint tendon, and fascia transversalis. These three structures form the posterior wall of the inguinal canal. Take a look. Reflected fibers of inguinal ligament, internal oblique and transversus forming the conjoint tendon, and were you to remove this, completely the posterior wall is formed by fascia transversalis with a little gap in it called the deep inguinal ring. Anteriorly, we discussed structures forming anterior wall. Now we discuss three structures forming posterior wall, reflected fibers of inguinal ligament, conjoint tendon, and the fascia transversalis. What is fox inguinalis? It's another name for conjoint tendon. It's asked in Vivas, okay? Be prepared for this question. Right. So posterior wall ho gaya. Now we'll talk about a hole in the posterior wall, the deep inguinal ring. So the deep inguinal ring is a V-shaped opening in the fascia transversalis. Look at the image. Don't keep listening to me. Look at the images. That will help you more. This is the deep inguinal ring. It is situated 1.25 centimeter above the mid-inguinal point surface. You have to learn to mark this on the cadaver. Walls continue down as the internal spermatic fascia pause. Who continues as external spermatic fascia? External oblique. Who continues as internal spermatic fascia? Fascia transversalis. The superior crus is attached to the transversus muscle. You can see it here. The inferior crus is anteriorly covered by the internal oblique. I'll tell you why we are discussing this. What are the relations of this deep ring? Again, I have the same advice to you. If there is a hole in a wall, something is going to pass through it. Okay. So what is the strengthening given to this hole so that there is no hernia formation? That is why we must know what are the relations. The deep inguinal ring is protected anteriorly by fibers of internal oblique muscle. Deep inguinal ring is protected anteriorly by fibers of internal oblique which arch over it in this manner. Okay. So, above, it's related to transversus abdominis. In front, it's related to internal oblique muscle which protects it from anteriorly. One last relation you should know, the deep inguinal ring is related medially to the inferior epigastric artery. Very important relation. Okay, you must remember it. I don't have the time to explain this diagram to you, but the labels are there. I suggest you pause the video and understand it. Okay. We've recently learnt about the anterior wall, lower end of inguinal canal. Then we talked about posterior wall and upper end of inguinal canal. Now, we need to study the superior wall, that is the roof, and the inferior wall, which is the floor of inguinal canal. This will be covered in Inguinal Canal Part 2, okay, in which we will understand how to draw the inguinal canal so as to learn about the roof and the floor. Then we'll specifically discuss the roof and the floor. Then we'll talk about the contents of inguinal canal. This will be followed by discussion on defense mechanism of inguinal canal and applied aspects, which obviously include inguinal hernia, direct as well as indirect. So my strong suggestion to all of you is follow this lecture, which was part 1, with viewing of Inguinal Canal part 2. The link for that is given in the description section. Thank you, students. I hope you enjoyed this lecture. I am requesting all of you to like and subscribe to my channel. I'm also requesting you to write some comments. Are you enjoying lectures? What do you want more in this lecture? It would really help me to provide you with better and better lectures and help you to study your subject of anatomy. All right, students, I had a great time taking this lecture. I hope you enjoyed it too. See you across the screen in some other video. Bye.